Good morning. So my presentation today about Alzheimer's disease. And first of all, I would like to thank Dr. Stein to help me with this presentation. So we're gonna talk about the general term dementia. So dementia it's like a general term for many diseases. It's described as umbrella term, so referring to many different type of dementia. So at this diagram, the most common type of dementia is Alzheimer. So it's illustrated as the handle of umbrella, and the other diseases described like the separated section of umbrella, which is like vascular, Lewy body, frontotemporal type, Huntington, and pseudodementia, drug-induced, and normal pressure hydrocephalus. So with my presentation, I'm gonna talk about Alzheimer. So Alzheimer disease is a neurodegenerative disease that usually started slowly and progressively worse. So it's take like 60 to 70% of causes of dementia. At this diagram, we're gonna see like the comparing between the patient with Alzheimer brain atrophy and the brain section with a person with a healthy brain. So we're gonna see like in this section the difference between two types. So in the patient with Alzheimer brain, there is enlargement of the ventricle cavity, atrophy of sulci, and the atrophy in the white matter. So, and the main point, there is atrophy of the hippocampus. And the most common early symptom of Alzheimer is starting with difficulty remembering recent events. As the disease advances, the symptom can include problem with language, disorientation, so the patient suffer from easily getting lost, mood swing, and the loss of any motivation with self-neglected. So the person condition gonna be decline gradually, which lead to be withdrawal from the family, from the society, and ultimately leading to the death. Although the spread of the progression can be vary, the typical life expectancy following diagnosis is 3 to 9 years. So we're gonna talk about the sign and symptom of Alzheimer. So the course of the Alzheimer is generally described in 3 stages: mild, moderate, and severe. The first symptoms are often mistaken to the patient relate to the aging and stress. So after doing that, neuropsychological testing can relieve mild cognitive difficulties, which take about 8 years before the person fulfills the clinical criteria for the diagnosis of Alzheimer. So we're going to talk about the early stage, middle stage, and the severe stage. So the patient with the Alzheimer at the beginning, that he has like an increasing impairment for learning, memory eventually lead to the definitive diagnosis. And the patient has difficulty with language, with perception, which means he has like agnosia, and difficulty with movement, apraxia, and then the patient at the end feel he has memory problem. During the middle stage, the patient progressive deterioration eventually to hinder independence, with subject being unable to perform most common activities. And so at the end, the inability to recall vocabulary, which lead to use like incorrect and substitution words, which lead to the which is called parapheresis. So the reading and writing skill are also progressively lost. And at the end of the late stage, during the final stage, there is complete dependence on caregiver. The language is reduced to the simple phrases or even to the single words. So we have the diagram. So about the Alzheimer staging. So we have, like, at the beginning, there will be mild cognitive impairment, which take like 7 years, and the disease began in the medial temporal loop. So the patient will suffer from short-term memory loss. And then the mild Alzheimer, it take like 2 years, and the disease will spread to the lateral, temporal, and parietal loop. So the patient will suffer from problem with reading, object recognition, and the poor direction sense. And the moderate Alzheimer is take 2 years. The disease spread to the frontal loop. The symptoms include poor judgmental and the impulsivity with the short attention. So after 7 and 2 years, 2 years, it's like the 10 years, the patient suffer from disease, severe Alzheimer. It's take 3 years. So the disease spread to the occipital loop, and the problem will gonna affect the visual problem. So this is the late and severe Alzheimer stage. So we're gonna talk about the causes. The main causes of Alzheimer, the protein fail to function normally. This disrupts the work of the brain cell, which lead to the cell death and the brain shrinkage. So Alzheimer, it's believed related to the abnormal amounts of amyloid beta, which accumulated on extracellular lead to formation neurofibrillary tangles form in the brain, which affect the neural function and connection nerve, resulting in progressive loss of brain function and lead to the neurodegenerative diseases. So this is the main causes of Alzheimer. We're gonna talk about the second cause, which is related to the genetics. It's only take 1 to 10% of Alzheimer. So Alzheimer disease inherited as the autosomal dominant. These types are known as early onset of familial Alzheimer disease, can have a very early onset and faster rate of progression. It's opposite to the usual type of the Alzheimer, by it's happen early and faster rate. So the type of the genetic mutation here, it's related to the APP gene chromosomal, which located in the chromosomal 21, which make up 20 to the 15% of early onset familial autosomal dominant. So the main age for this disease is 49, and the cause related to this disease increased amyloid formation. There are difficulty removal the amyloid plaque from the brain. So the patient who has Down syndrome, who has like extra APP gene, so almost 100% of Alzheimer's disease by age 40. And we have another gene mutation related to the Alzheimer. persanylene gene, which is located in the chromosome 14. They encode the protein BSEN1. So mutation is in this gene lead to the 50% of early onset familial Alzheimer's disease. This is the early onset for Alzheimer's disease. We have genetic mutation which cause late onset of Alzheimer's, which is related to the apolipoprotein. There will be a problem with the lipoprotein metabolism about the band who is responsible for the band and the transport lipid. So there are three major lipoprotein: ApoE2, ApoE3, ApoE4. So the APO3, who is like protective against the amyloid deposition, and the ApoE4, who is responsible for the amyloid. So E3, it will be the protective, and the E4 is the worst type, which lead to the late onset of genetic Alzheimer's disease. So we're gonna talk about other type of other hypotheses which explain the pathophysiology and the causes of Alzheimer's, which is related to the tau protein abnormalities. In this type, there will be hyperphosphorated tau protein. It's begin to pair together to form like helical filaments, which eventually lead to the formation of the neurofibrillary tangle inside the nerve cell bodies and lead to the destroy the cell cytoskeleton, which collapse and their effect on the neuron transport. And we're gonna talk about pathophysiology of Alzheimer's. Alzheimer's disease is characterized by loss of neurons and synapses in cerebral cortex, which lead to the atrophy of the affected region, which include degeneration, temporal, parietal lobe, and frontal cortex, and cingulate gyrus. And at the end, its effect on the locus coeruleus, a nucleus which is located in the bones. So we're gonna see in this diagram the amyloid deposition into the nerve tissue, which lead to formation of the neurofibrillary tangles, which lead to the a neurodegenerative disorder and the loss of a neuron connection. So here we have like paragraph about how the pathophysiology happen in the single neuron. So about the genetic type, we're gonna like if the patient have APP gene mutation. So this is the cell nucleus. So this is aggravative factor to formation neurofibrillary tangles, which lead to the degenerative of a neuron and formation of amyloid plaque at the end of the neuron, which lead to the neurodegenerative and atrophy of a brain neural cell. And after the patient suffer from all these symptoms, so we have many methods to diagnose Alzheimer's. So first of all, the patient diagnosis is depend mainly on the medical history. We're gonna ask the history from the relative, and we need to ask the patient relative about behavioral observation. So the patient with Alzheimer usually decline if he like the patient denies always about a memory a problem or behavioral problem. So the main point, we need to ask the relative if there is any change in the patient behavior. So and after taking the history, we need to do like many images like CT, MRI, and the PET, which used to help exclude other cerebral pathology or subtype of dementia. So assessment of intellectual function, including memory testing, can further characterize the state of disease and help to reach to the definitive diagnosis. So we have many images about that. We have MRI of the patient suffer from Alzheimer. So on the right side from the screen, the patient this is for the normal person, and on the left side the patient has atrophy in the hippocampus. And I have section from the PET scan about hypometabolism of amyloid, which lead to the deposition of the amyloid to the patient suffer from Alzheimer. So we're gonna look for deposition amyloid on this side, and this side, and this side. And for more diagnosed Alzheimer disease, we have many tools about that. Diagnostic and Statistical Manual of Mental Disorder, DSM-5, define the criteria for probable or possible Alzheimer for both major and mild neurocognitive disorder. And we have other tools about that. National Institute on Aging Alzheimer Association, NIAA. This mainly used for the research rather than clinical assessment about the patient with Alzheimer. And we have many tools about testing the cognitive to assess the patient with Alzheimer. It's like many mental state examination, MMSEO, and the Montreal Cognitive Assessment, MOCA. So all these tools, it's help to assess the cognitive for the patient with Alzheimer. And we need to use other tests like supplement tests, which including the blood tests and the thyroid function test, to exclude any patient if the patient have any thyroid problem or any type of anemia. If the patient have B12 deficiency, maybe lead to cyanide symptoms similar to patient with Alzheimer. And then we need to ask the patient about if the patient have any depressive symptom, any depressed mood. So because the depression lead to which is called pseudo dementia, and with antidepressant treatment, the patient will improve gradually. So we have many theories to prevent about Alzheimer's disease available. So first of all, there is many risk factors of Alzheimer, like hypercholesterolemia, hypertension, diabetes, smoking, and using the statin. It leads to the low cholesterol and maybe benefit in Alzheimer. and using antidepressant drug to prevent any depressive symptoms. There is many ways about the lifestyle, like doing physical exercise, associated with decreased rate of dementia and effective in reducing symptom severity. And we have like theory about cessation of smoking, reduce the risk of developing Alzheimer, specifically with the people has carry APOE4, which is like bad factor for Alzheimer. We also many theory about stress is a risk factor for development of Alzheimer. The mechanism by which stress predisposes someone to develop Alzheimer is unclear usually, but suggests that the life stressor may be affect a person, which lead to the overexpression or underexpression of specific gene. We're gonna talk right now about the management. We have the simple diagram about how we're gonna manage the patient with Alzheimer. The main point here, we need to treat the cognitive impairment. So we have many medication to improve the symptom, but there is no cure about Alzheimer. So we have CHAIS cholinesterase inhibitors, which is include donepezil, rivastigmine, and NMDA antagonist, memantine. This is the main drug to improve like the symptom with Alzheimer. And we have many drugs to, it's like the minor rules to manage the like hallucination, delusion, agitation. So we're gonna use antipsychotic, typical and typical drug. And if the patient suffer from depression, we're gonna use a tricycle antidepressant, SSRI, to treat the depressive symptom for patient. So about the management, why we use this treatment? Because Alzheimer's disease, it affects the central and peripheral system. So Alzheimer's disease, it's related to the reduced acetylcholine in the brain and increase the NMDA receptor. This receptor exaggerating receptor, which lead to the influx of the calcium and lead to the inflammation. So the main point for treatment with Alzheimer, increase the acetylcholine level and the block NMDA receptor. So which lead to the improve the cognitive function with a patient with Alzheimer. So we have many types for medication, acetylcholinesterase inhibitor, as we said before, Altekrieti and rivastigmine, donepezil. It's used for mild and severe Alzheimer by reduction of this enzyme and increase the cholinergic neuron activities. Memantine block release glutamate by NMDA receptor antagonist. And we have to manage, like if the patient have any psychotic symptom and depression, we need to use antipsychotic and antidepressant. Besides the medication, there is many methods to improve the cognitive function with the patient with Alzheimer, with psychosocial intervention. It's use adjustment to the pharmaceutical treatment by behavioral, emotional, cognitive, or stimulation-oriented approach. And, especially at the latest stage of Alzheimer's, so the patient will be depend on the family. So we need to ask many questions. I take care of the caregiving. Since the Alzheimer no cure, it's gradually render on people. So this is also a main point in the treatment. And we have like the other factors so important with patient Alzheimer diet, which also the Mediterranean diet and Dutch diet are both association with a less cognitive decline. So we're gonna talk about the prognosis of this disease. So the life expectancy of people with Alzheimer is reduced. The normal life expectancy for 60 to 70 years is 23 to 15 years. For 90 years old, it's 4.5 years. Following Alzheimer diagnosis is range from 7 to 10 years for those in 60 and early 70. So the main causes for death with patient with Alzheimer is usually related to the pneumonia, dehydration, the most frequent immediate causes of death brought by Alzheimer, while cancer is a less frequent causes of death than in general population. So there is a new study about relation between COVID and Alzheimer risk. So COVID has been linked to significantly increased risk of a new onset Alzheimer. This is a new study suggestion. The study for more than 6 million people aged between 65 or older found 50 to 80% increased risk of Alzheimer's disease, and especially with women older than 85 years. So, however, the investigators were quick to point out this observation retrospective study offered no evidence that the COVID causes Alzheimer's disease. There could be viral etiology at play, or connection could be related to the inflammation in neuron tissue from the COVID infection. So this is the reference for my presentation. And if you have any question, let me know. Thank you so much.
Okay. Thank you. Wow. Okay. A profound academic presentation. Okay.
Thank you so much.
Now let me give you criticisms. Okay.
Okay.
3 times too long. You are mostly reading with your cursor.
Okay.
Everybody else can read too.
Oh.
So you have to talk about it and not read it. Okay.
Okay.
Okay. You have to find, this is takes about 45 minutes, a very, very long presentation.
Oh, okay.
Okay. And you have to think about the audience. Okay. With a very long presentation, I get overwhelmed. There's too much information for me to carry away. Okay.
You're right. You're right. Yeah.
And look, this is these are very, I think you're fantastic. So I'm trying to give you some more information. Okay.
Okay.
Too many words, and you need many too more words on those. You need like 5 to 6 lines of big font, like you have. Okay, so people can read it, and then you talk about it. You don't read it. Okay, we'll do this.
I try to read it and explain. Yeah.
Doesn't look good because you're reading it and you're pointing with your cursor.
Yeah.
If you're reading it, I can read it too.
Yeah, you're right.
So so much less on the screen. It's okay to use your cursor on a diagram to point
Okay.
it, but it does show if you're going to read it, everyone else can read it. It's not really a talk. You know what I'm saying? It's read with me, and that's not good.
Yes.
Okay.
All right.
We have time to fix this. Let's see. Also, antipsychotics decrease the amount of acetylcholine, whereas the drugs we give increase it. So be careful with the idea of antipsychotics with Parkinson's disease. You have to find something else because it makes it worse.
Yeah, you're
Yeah.
right. Yeah.
Now, there are other things for Parkinson's disease: is singing, dance, movement therapy, and physical therapy. That's okay.
Yeah.
But basically, what else did I write down here? Wait. It's hard to put it's easy to put everything. It's hard to put a small amount, but the way it comes across best is you put up 5 or 10 words and then talk all about it. So it shows that you know rather than you read. Okay?
Yeah, you're right.
And this is for an audience.
Yeah, definitely. Yeah.
No, look, this is a review article. Okay, it really is. This is a review article.
Yeah.
But for a presentation, it has to be much. There's too much information.
Yeah.
Okay?
Yeah.
God, I can try to find. There are some perfect presentation. I'll try to show it to you. Also, you didn't put MD after your name on the opening page.
Oh, yeah.
Okay. Now I'm giving you a lot of hard stuff, but I want you to be successful. Okay. And I come on strong, but I just say what I feel. I think you should take a little bit of maybe 5 to 6 hours on accent reduction. You want to come across more as an American and less like an Iraqi.
Okay.
Alzheimer is not the way you you pronounce it. I can give you some references. You can go online and give a sample of your talk, and maybe it's not much, but get a little bit of advice about how to painfully switch to an American accent.
Okay.
Okay. These are all hard suggestions, but I think they make a lot of sense.
Yeah. Okay.
Okay. And I'll send you I will send this the video to you. You can see. But I think we want to see if we can make a change. I mean, I want to get you in the best shape. Okay. Now the people are online here. Let me talk to them online for a second. Let's see. Stop recording.